if someone was planning on getting their cat or dog neutered or specifically spayed, but it escaped the yard and did get mated, you do not have to wait until the animal has puppies in the end and get it spayed. We do routinely spay an early pregnant mom. We can spay that mom. It is better to not have unwanted litters. You don't have to think that because it has been mated, that it definitely needs to have puppies.
Welcome back to the Pause and Effect podcast, where we bring you expert insights to help you care for your beloved pets. I'm your host, Dr. Cara, a veterinarian passionate about providing credible information for pet owners. In today's episodes, we are diving into the fascinating and often misunderstood topic of pregnancy and gestation in our dogs and cats. To guide us through this journey, I am joined by Dr. Derisha Reddy, a skilled veterinarian from KZN with extensive experience. We'll be discussing everything from recognizing the early signs of pregnancy to the typical gestation period to how you can best support your pet during this critical time. Whether you're a breeder or a pet owner who just wants to be prepared, this episode is packed with vital information. Let's get started. Welcome back to another episode of the Pause and Effect podcast. I'm your host, Dr. Cara, and I have a returning guest, Dr. Derisha Reddy.
Hi.
Hello, welcome back.
Thank you. Good to be back.
It's so great. I really enjoyed our last conversation, and I think
did too.
It was so valuable. Vomiting and diarrhea in pets. We've had a lot of feedback to say it was helpful.
Good.
People now know how to tackle it, and so thank you very much for your time today. But today, we started talking about this after our last podcast, saying, there are so many valuable topics that we can tackle as vets. That people are just searching for this information.
Yes.
And I'm doing this as a bit of a disclaimer right at the start, because I know we may get a bit of kickback in terms of how can we discuss this and promote our topic of conversation today. And this is talking about pregnancy, lactation, and gestation generally, but also the process of giving birth in our cats and dogs. So I'm starting by saying we are not promoting owners doing this.
Of course, 100%. 100%.
We are advocates for both responsible pet ownership as well as responsible breeding.
Yes.
But we do have a lot of people who either, let's say a case example, we see cats come in as strays, and owners or new owners will say, I don't know whether this cat's been spayed. Is she pregnant? So this is something we do deal with, whether it's an accident or something that happens.
Yes.
So I'd like to just tap into some of the pros, some of the cons, and some of the problems that we face as pet owners when our pets become pregnant. So I think my opening question to you is, let's talk just generally about the time frame that we're looking at. So let's use the example of our cat. You've just taken on a cat. Let's talk about pregnancy.
So cats are pregnant for roughly 65 days. This is just over 2 months, which is much shorter than a lot of animals. So they become pregnant quite easily, quite quickly. Cats are very fertile creatures. And if someone does bring in a stray cat and they were wondering, is it sterilized? The best thing to do would be to take it to your nearest vet. The vet can scan it first for a microchip, because it might be owned by someone who maybe lost their cat or has emigrated and doesn't know what's happening with the cat, and then we can pick up those records and see, has the cat been sterilized? That's a very easy way of finding out. In the early stages of pregnancy, it is a bit more difficult to find out if an animal's pregnant, a dog or a cat. But there are certain things that we can do to visualize the fetuses inside. So from day 21 to 25, we can use an ultrasound scanner, and we can actually look at those fetuses if they're there, and we can see little fetal heartbeats. Later on in a pregnancy, so from day 42 onwards, the fetuses have skeletons that mineralize, so those will be picked up on an X-ray. Earlier than that, you won't pick up anything on an X-ray. So if you're not sure about pregnancy, I would start with an ultrasound and see if there are fetuses in there. If it's earlier than day 21, you can't rule out pregnancy, but that's where we can start.
Interesting. So, I qualified in the UK, as you know, and we always used to do our spays, particularly for cats.
Flank spays.
On flanks. And that was a great way for us to be able to shave and clip that area and look for a surgical scar for an incision.
Yeah.
And that was a nice way for us to do it. Obviously, it's a little bit different here in South Africa because surgeries abdominal as well as cesareans and spays are done midline.
We do midline on the abdomen area, so around where that umbilicus is. And in some cases, non-absorbable suture material is used, and you can feel the sutures that are still in that animal's skin, under the skin for the rest of their lives. But in many cases, it's absorbable suture material that's used to close the internal layers after the spay or C-section, and you might not feel the sutures, and there might not be an appreciable scar there. Mm-hmm. But yes, sometimes we feel, and we can feel sutures, and then in 99 out of 100 cases, that would be from a spay. Yeah,
absolutely. Yeah. So I think the reason why I also wanted to start a discussion on understanding sort of early pregnancies, there are a few things that we would want to do as pet owners or as vets in terms of managing nutrition and some preventative medicines. Can you take us through some of the nutritional considerations if we do discover that a pet or a breeder brings in a dog or a cat that is pregnant?
So once the animal has been bred and we are convinced that it's pregnant, you want to feed this mother a very, very good quality diet. So an adult dog or cat food, depending on the species, and you want to chat to your vet about really good brands that are going to give good nourishment. You don't want to overfeed in the first 3 quarters of the pregnancy, because you don't want that animal to put on a lot of intra-abdominal fat, because then giving birth would be more difficult. But in the last 2 weeks of pregnancy is when the fetuses really have a growth spurt. That's when you'll appreciate that the abdomen starts getting quite swollen, and the mammary development starts. And that's when you want to switch from an adult dog or cat food to a kitten or puppy dog and cat food. Because the uterus gets quite big in that stage, it actually pushes against the tummy. So there's not enough space in that animal's stomach to fit in as much food as they would need to eat. So if you switch over to puppy or kitten food or kibble in those last 2 weeks, the dog or cat is getting much more nutrition in a condensed version. But you don't want to start the puppy or kitten food before those last 2 weeks, because you don't want the animal to get too fat. Another important consideration with regards to nutrition would be never supplement vitamins and minerals, because you might be doing more harm than good. A prime example would be calcium. Many owners are under the impression that if you give the mother dog or mother cat calcium while it's pregnant, then it'll have more milk, or the puppy's skeletons will be stronger or heavier or bigger. And that is a very, very serious problem, because an animal has a hormone called parathyroid hormone. And if you supplement an excess of calcium in the animal's food, the body actually interprets that as needing to take out calcium from the animal's bones, and the animal actually results in less calcium than it needs. And this causes problems with regards to fetal mineralization of the skeletons, and can cause what we call milk fever once the mother is lactating. So never supplement vitamins or minerals. You stick to your really good quality dog or cat food, adult food in the first 2/3 of the pregnancy, and then puppy or kitten food in the last 2 weeks of pregnancy.
That's great. And so a lot of owners will then start asking me about vaccines and deworming. What is the recommendation in terms of vaccination during pregnancy and deworming?
Vaccinations should be avoided during pregnancy. Your animal should ideally be vaccinated before it is mated, so that those antibodies can be passed on to the fetuses, and the fetuses are then born with a level of antibodies and protection. Many of our vaccines are live vaccines, and it's going to be what we call teratogenic to fetuses. So it can impair and harm the development of the fetuses as they're growing. So your animal should be vaccinated before it's mated. In terms of deworming, there are some dewormers that are safe for pregnant and lactating animals. Those are the ones, that your vet will discuss with you. Some are safe and some are not. So it's best to chat to your vet about which ones are safe. We always advise using the safe dewormer in a pregnant animal, because worms are actually passed on from the mother to the fetus and secreted in the mother's milk. You won't see worms coming out in the milk, but they are microscopic. And as those little puppies or kittens latch on and suckle, they're getting worms from the mother. So it's important that for quite a good deworming schedule in the pregnant mother, and also while the mother is lactating.
Absolutely. And so, we now are approaching a point where we know that they're pregnant, and sometimes we have an indication, dependent obviously on each case, whether or when they're due to deliver. I'd like to have a bit of a discussion with you about natural versus C-sections, because there are obviously some breeds and some animals are predisposed to requiring C-sections. And I, from experience, have had breeders come and say, I want you to do a C-section now, and very hesitantly I've had to explain why I will not do so, because, like you said, it's a very, very short pregnancy in comparison to ours. And in terms of development, those last few days are critical.
They are.
So can we talk about natural versus C-sections and your thoughts on it?
So there are some breeds, like you say, that will, in most cases, if not all cases, require a C-section because of the shape of that dog's body. So if you consider the very short, stocky dogs with flat faces, like bulldogs and French bulldogs, sometimes Boston Terriers or pugs, the fetuses are so stocky and the mom's pelvis is so narrow that they cannot push it out physically. It's an impossible space to push out the puppies. So in those cases, C-sections are actually better. And, a wise breeder will know when the dog is mated, and then we can plan. The gestation is roughly 63 days for a C-section. What a vet can do is then monitor things like daily temperature and know when to plan that C-section more specifically to the day, because a dog's temperature will drop a little bit, 1 to 2 degrees lower than normal, just before it's about to give birth. So in those cases, yes, C-section is better. But that doesn't apply to all cases. Because like you say, in those last few days, in the last 2 weeks, those fetuses grow rapidly. And a lot of lung maturation and things like that are completed in the last few days. And you don't want to remove puppies or kittens unnecessarily from that uterus when they're immature, because unlike human babies, they are blind, they are deaf, they are very immature. They need every single minute of maturation in the uterus as possible. So it's safer for them to give birth naturally. If an owner's worried, if they feel like it's something that should be maybe done at a vet, then there are people who drop their dogs off at the vet on a daily basis, and then the nurse and the vet can monitor the whole what we call whelping process when the animal gives labor, and then the puppies are monitored safely.
Hello, I'm Dr. Kara, a veterinarian and the host of the Pause and Effect podcast. Our show is all about enhancing the lives of pets by providing reliable, science-based advice and engaging in discussions with experts in veterinary medicine, pet nutrition, and animal behaviour. As a professional with years of experience in both the UK and South Africa, I run a 24-hour veterinary hospital and an online pet store. I'm also pursuing a master's in animal nutrition and consult for UltraPet, a local veterinary-grade pet food manufacturer. My passion lies in sharing knowledge and helping pet owners make informed decisions about their pet companions. The Pause and Effect podcast is rapidly growing, attracting a dedicated and engaging audience of pet owners who are passionate about their pets' health and well-being. Our listeners trust us for credible, informative content that empowers them to provide the best care for their animals. We are looking for sponsors who share our commitment to pet health and who want to reach a highly engaged and expanding audience. Partnering with us means aligning your brand with trusted and influential content that resonates deeply with pet owners. As a sponsor, you'll benefit from high visibility on a platform that is used for multiple purposes, including educational content, product recommendations, and community building. We offer various sponsorship packages designed to fit your marketing goals and budget, ensuring that your brand gets the reach and the impact it deserves. Join us in making a difference in the lives of pets and their families. Let's work together to bring valuable insights and quality products to our passionate audience. If you're interested in sponsoring the Pause and Effect podcast, please get in touch. I look forward to partnering with you. Before we continue, let's address a critical aspect of feline health, weight management. Allow me to introduce you to UltraPet's special diet, Metabolite cat weight loss food. It is available in 2 kg and 4 kg packs, specially crafted to support your cat's well-being and vitality. This recipe isn't just about reducing weight, it's about promoting healthy weight and management. With 34% protein, 11% fat, and 4% fiber, it helps control lean muscle mass while maintaining a healthy weight, ensuring optimal nutrient absorption. Featuring a tantalizing chicken and rice flavor, UltraPet ensures that even the picky eaters will enjoy their meals. The vacuum-coated kibbles deliver a taste experience that your cats will love. What sets this weight loss food apart is its formulation made with fresh meat, providing a healthier source of protein. Plus, the added addition of taurine supports good eyesight development and a healthy cardiac activity. With omega-6 and 3 fatty acids, this food promotes a shiny coat and a healthy skin. Additionally, the inclusion of VitaCat ensures essential vitamins and minerals for healthy development and immune system protection. The prebiotics in this formula create an environment for microflora to flourish, further supporting your cat's digestive health. UltraPet's special diet Metabolite is an ideal choice for overweight cats. Just ask Freya, my Bengal, who has thrived on this diet. Give it a try and see the difference for yourself. Your cats will thank you, and you'll appreciate UltraPet's commitment to feline health. Now, back to our episode. So assuming that we don't have a breed that is predisposed to potentially higher risk of C-section or requiring one, what are the sort of signs? Let's assume that it's going to be a natural birth. What are the sort of signs that owners can look out for that indicate that it's either imminent or that labor has started?
So the stage 1 of labor in dogs and cats is when the temperature drops, and that is because of a sudden decrease in a hormone called progesterone in the animal's bloodstream. So when that happens, they will start labor, and that can be from the next 24 to 36 hours. The animal will very strongly start sort of what we call nesting behavior. So if there is a certain dog basket or bed that's set aside, this animal will circle and settle and really try and find that safe space that's warm and quiet where they can go into labor. But in most cases, the labor actually only starts when the dog starts straining. So you'll notice contractions, you'll notice straining, and then there'll be a little bit of vaginal discharge. A little bit of vaginal discharge is normal, and the puppies in general are really pushed out quite easily, and they slip out quite nicely, covered with a little clear sac. And in most cases, the mother dog and the mother cat naturally knows what to do in those cases. So we look for nesting behavior and a drop in temperature. Those are the most important things to look for.
Okay. And when would you advise owners seek veterinary advice or help if things are not going to plan? What are the sort of key indicators that there is a problem?
So if the mother dog is straining for more than half an hour and there's no puppy produced, it's best to take the animal into the vet, because then we can really check on what's going on. And there's 2 ways that we do that. We take an x-ray to see if maybe the diameter of the puppy's head is bigger than what the narrowness of the pelvic canal is. So we actually measure in centimeters on an x-ray the distance from one side of the hip to the other side of the hip, and we say, okay, that's 2 centimeters, and then we measure the diameter of the little fetal skeleton head, and we say, oh, that's 2.2 centimeters. There was never any way this puppy was going to come out. So if the animal's straining for more than half an hour, if there's excessive vaginal discharge, especially a bloody discharge, a little bit of blood is normal, a lot of blood is not normal. If there is a green discharge, that puppy should come out within 10 minutes. Because a green discharge means that the placenta inside the uterus has released from the uterus, so it's not attached anymore, and that puppy should be on the way. And that green discharge means that the puppy has not come out. So if it's not out within 10 minutes, then you need to go to a vet. If the animal also gives birth and the puppy's covered in a sack and the mum, in very rare cases, is not interested, then the owner needs to get involved and have a couple of dry, clean towels around and gently wipe the sack away and dry the puppy's mouth, dry the puppy and rub the puppy with a dry towel along the back to stimulate breathing and to help the puppy latch onto the mum. And then they have a little umbilical cord that will need to be tied off. So you'll need to have a sterile scissors and a little bit of cotton or string to tie that off 2 centimeters from the puppy's tummy. So those are things where you'd want to get your vet involved.
Absolutely. And I mean, we're talking about the process now that, if whether it's via C-section or we are part of the labor process as vets, there are a few checks that we do that we're just checking generally, like you say, for whether there's breathing, whether the mouth is clear. We're looking at the umbilical cord. What are some of the other checks that we do sort of instinctively generally to check and see whether that puppy is healthy and whether there are any congenital issues?
So once the puppy is born, we check that it's breathing and that it's squealing and that it sounds vigorous and healthy. We dry off all of the discharges that it comes covered in. We look inside the mouth and we check the palate, because some puppies are born with a cleft palate where there's actually a hole in the inside of the mouth up against the roof of the mouth, and that'll be problematic because every time puppy suckles, the milk then goes up into the nasal cavity. So yes, we check for number of toes on the front and the back. We check the cleft palate. We check that puppy is breathing and healthy and squealing. We check that it's able to latch on to a teat and start to suckle within a few minutes of being born, because that shows that the puppy is strong enough and healthy enough to suckle.
Absolutely. And you made mention of the umbilicus. Can we discuss umbilical hernias and umbilical issues, especially if the mother has sort of tried to detach that placenta themselves? So sometimes
Yes.
I've seen some injuries. Can you discuss what happens?
So sometimes the mum will bite off the umbilical cord and eat the placenta, which is a normal thing in dogs. And I also hear some humans like to do that, but let's not cross that road. It's a little bit out of my comfort zone.
Yeah, no, that's not my scene either.
No. And sometimes the mum can maybe chew a little bit too close to the puppy's tummy, so that umbilical cord is too short, or can maybe nip the skin around the umbilicus. In most cases, the mum knows how to cut that, and then you would want to take a little bit of string and just tie it off so that there's no discharge or bleeding from that umbilical cord. If it's too long, you want to shorten it to 2 centimeters. If it's too short, you just want to keep that place quite clean. So you'll take a little bit of disinfectant or, with a bit of cotton wool and just clean that area. If there is an injury, so the mum has chewed too close and there's a bit of bleeding, or if the skin is broken in that area, then you'd want to get that pup seen by a vet.
Absolutely. So what is an umbilical hernia? Why is that different?
So an umbilical hernia means there's a swelling or a lump in that umbilical area because the inside layers of the abdomen haven't closed as they should. So there's a very inside layer that holds all of the guts and the stomach and all the abdominal organs internally. And then there is muscle, and then there is skin. And sometimes the muscle defect is a bit weak, and in very serious cases, the very innermost layer is a bit weak or open, and then actual guts will come between the skin and the internal organs. But in most cases, it's just under the skin where a bit of fat or protrudes through from the inside. And that is something that we can correct when the animal is older and is presented to the vet when it's a few months old to be spayed, and then we can correct that at the same time.
Absolutely. So let's go back to our situation where we've got a dog or cat giving birth at home. And like you say, you've set up a really nice space, somewhere warm, out of the way, minimal interference. I mean, I generally advise families, as much as they want to be part of the process, to kind of be respectful of it, because
Yes.
we actually see more trauma and stress
By getting too involved.
Absolutely. How do owners know when it's all over?
So it's a good idea when your animal is pregnant to get it seen by the vet so that we can ultrasound and that we can do an x-ray. And an x-ray is an ideal thing to do, like I say, when the animal's been pregnant for 42 days or longer, so we know how many pups or kittens to expect. So if the vet has told you, yes, there are 3 or 6 pups or kittens, then after the 3 or 6 pups or kittens have been born, you know not to expect anything more. So in that would be the ideal scenario. But in general, the animal will stop contracting and nothing more will pass out.
And they'll start suckling generally.
The puppy starts suckling, the mother just starts grooming the puppies. What happens is the mum will suckle and groom and lick the puppy, and it'll have a suckle. And in not according to textbook in real life, but generally about every 30 minutes, a new kitten or a new puppy is passed. And if it's been 30 minutes or longer with no straining, safe to say that the mom, is done with the whole birthing process. In that case, what an owner can do is, if the blankets or towels that the mom and the kittens or the mom and the puppies are on has become soiled or quite wet from the whole giving birth process, that is when they should get involved, just to put some dry bedding in there. Otherwise, monitor from a distance. If the mom is straining for too long, if there's, like we say, the discharges we discussed, excessive bleeding, the green discharge or even a black discharge, then you get involved. If the puppies or kittens are injured in any way, then you get involved and you take them to a vet. In many cases, the moms know what to do more, I think, than our side, and the human side knows what to do.
They're very good.
Yeah.
And so now we've obviously got beautiful puppies or kittens, the start of what can be quite a stressful journey in terms of pet ownership.
Exciting, stressful. Yes.
So at what point would you say we should be asking owners to bring those puppies or kittens into us for a clinical examination? So what is the advice between that giving birth and coming in to see us, whether it's for preventative care or vaccines or whatever?
So let's talk about the mother and the puppies or the kittens. They've given birth. The vet doesn't need to be too hands-on for the first 6 weeks, but there are things that the owner needs to do at home that are very easy to do. Puppies and kittens should be dewormed at 2 weeks old and 4 weeks old. If you have a kitchen scale at home, then you can weigh the puppies or the kittens, and then you go to your nearest vet and say that they're this many weeks old and weigh this much on average, and then the vet or the nurse can give you little syringes with liquid dewormer to gently syringe into each puppy or kitten's mouth. That's very important to do. The other thing is the feeding of the mother now needs to be what we call ad lib. So the same puppy or kitten food that we started in the last 2 weeks of pregnancy should be fed while the mum is lactating for the entire 6 weeks, and should be now given in an unlimited basis, because the mum is now losing a lot of her body reserves to produce that milk. It's actually a huge strain on the mum's body, and they can't physically take in enough food, which is why they should be on a very good quality kitten or puppy food. And small breed dogs need to definitely be on a small breed puppy diet. So if you're feeding the mom well, the puppies are suckling, and you've dewormed them 2 and 4 weeks, then you need to take them into the vet for their first checkup at 6 weeks old for their immunization and for their first deworming by the vet.
Okay, well, that's great advice. So now you can probably tell where I'm going to go with this. We see some issues with poor nutrition, and we see them particularly in emergency type situations where we will get a dog that's brought in a seizure type state. Can you discuss how these present and what is actually going on for the listeners?
So I touched on this a bit earlier, where the mum's calcium levels in her bloodstream can actually be too low. This can either be from an oversupplementation of calcium by an owner, or an inadequate nutrition. So this actually happened 2 days ago at work. There was a Jack Russell with 6 little babies who were about 3-4 weeks old, and the whole tummy of the Jack Russell mom was filled with fluid because its nutrition had been so poor. This dog was unfortunately found as a stray on the road. So obviously had been scrounging for food, and that's what happened, was that the protein levels had dropped so low. And because it was a small dog and it had 6 puppies, this is a prime case that would develop what we call milk fever. So around 2 weeks, but it could be even up to 4 weeks old, puppies have a growth spurt and they suckle a lot more milk in that time period. In specifically small breed dogs, although it can be all larger dogs, they suddenly there's such a loss of calcium from the mom's body that they start to twitch or spasm, or in severe cases even have seizures. In those cases, that animal needs to be rushed to the vet immediately, because we actually need to give that calcium back into the dog injectably. And we need to draw blood from the dog to see what his calcium levels are, supplement the dog injectably with calcium, and then draw blood levels at time periods thereafter to see that the calcium, levels are back. In those cases, we also advise that the puppy should be taken away, if not all, at least most of them, and then bottle fed. There are some amazing puppy formulas for puppies and for kittens that are so close to the mother's milk, it's actually unreal. They've also released puppy formula and kitten formula that have antibodies in them, which is amazing. And then those can be bottle fed so that that strain on the mom's body is taken away.
So the other thing associated, and I feel so sorry for these mums because they really, like you say, they take strain, particularly because it's not just one puppy, one or two puppies or kittens. Generally, it's a whole litter.
Yeah.
The other thing that we see as veterinarians are infections, so mastitis. And then obviously uterine or discharges that are a sign of infection. Can we tackle mastitis first and what that is and how to spot it?
So mastitis is when those teats, or what we call mammary glands, actually become inflamed and very painful, and sometimes instead of normal milk there'll be like a different kind of discharge. And you'll notice that this happening because the mom is suddenly snapping at the fetuses or the puppies or the kittens when they try to suckle. And you might think, but she's been fine all along. What's happening now? And if you examine those teats, you might notice redness, swelling, heat, and gentle pressure might show you that, that doesn't look like milk. That actually looks bad and smells bad. In those cases, that animal needs to be treated by a vet for the mastitis to clear the infection and to give some pain relief for the poor mom. If the other teats are not affected, then you can then control the feeding by the puppies or kittens to concentrate on other teats and cover up. But in many cases, it's just easier and better to bottle feed the kittens and the mom. It takes the strain away from the mom. The mom can then start to heal and receive appropriate medication without worrying about if that medication is now going to be secreted in the milk and fed to the puppies. There are many medications that we cannot give to pregnant and to lactating moms.
Absolutely, that is a very good point. And discharges that are not appropriate. So, I mean, we generally see the milk fever and the mastitis maybe a little bit later, like you say, sort of 3-4 weeks. But we often see just after giving birth, we'll sometimes see an infection as a discharge from the rear end. Can you explain sort of how we tackle it and the sort of advice?
So, in a healthy animal, there will be a little bit of a bloody discharge, and which will decrease day by day. But a copious amount of discharge, I'm talking about more than 2 tablespoons of discharge, that's not clearing and it's not going away, and it's not, or it smells bad, or it looks like mucus or pus. Those are problems. Sometimes there is a retained placenta. So not every single placenta is passed out. That can be a problem. Sometimes there's a retained fetus. In some cases, that will be reabsorbed. In some cases, it's going to cause a problem and an infection. Also, in some cases, the uterus can get infected itself, and what we call metritis or even pyometra. So if there is excessive bleeding, if there is a black or a green discharge, or a mucoid or a pussy discharge, those are not normal discharges. A little bit of vaginal discharge that gets less day by day is normal, which most owners won't even notice because the mom kind of licks it away. So if you are noticing when you're checking the bedding every day, pools of discharge, that animal should then be examined by a vet. We'll take its temperature, we'll do a vaginal exam, we'll see what's going on and then treat accordingly. In those cases, the moms are also not as attentive to the puppies or the kittens because they're not feeling great. Yeah. So you'll notice the normal mothering, grooming, licking, and tending to the kittens and puppies will be a little bit more listless and lethargic.
Often not eating nicely either.
They won't be eating properly. A healthy mom will have a ravenous appetite. Might not start on day 1 because of the birthing process, but by day 2 she should start eating like she's got a bottomless stomach. That's healthy and that's normal. And like I say, she should be fed ad lib.
Absolutely. So I think one of the questions I know we're running out of time, so I want to take the opportunity to ask you is, at what point should we be intervening, or do we leave it up to the mother that we say enough now with suckling? So at what point should we be trying to wean our puppies and kittens from the mother?
A healthy age to wean would be 4 weeks. From 4 weeks, we'll start to offer what we call like a gruel or semi-solid food. So in general, the puppy food that the mom is on, you can add a bit of hot water to that and start to offer that to the puppies. At 4 weeks old, puppies and kittens are exploring, and they might be wobbly, but they're wandering around and they're very interested in other things. And then if you start to offer that, it just has to be with a clean towel, because they often will use the food bowl as a swimming pool, and there's a lot of mess involved, but it's a lot of fun, and it's a lovely time to start weaning and get the pressure off the mum, because those tiny little shark teeth start growing at 4 weeks as well, and she's not going to be keen thereafter to let them latch on and suckle as those teeth grow. So 4 weeks is a great time to start introducing pre-soaked semi-solid puppy food, and then as they get closer to 6 weeks, the amount of liquid decreases so they can chew on tiny, hard puppy kibble. At 6 weeks, you'll definitely notice the mom trying to make an escape when those puppies start to try to suckle, because they do push their luck and they really try to suckle as long as possible. For them, it's more it's comfort. It's what they are used to. It's bonding with the mother. But by that stage, the mom has normally had enough. So by 6 weeks, fully weaned, and by 4 weeks, introducing weaning.
Absolutely. And then I think my final parting question for you is, when we have, let's say, we've got the stray, or breeders obviously have their own, respecting that they know what they're doing, their own programs. But at what point would you then be advising if the owners say, I want to spay her now, it's time? When would you be advising that? After?
Normally 3 litters is more than enough for a bitch or for a queen. The uterus does take strain every time they are pregnant and have kittens or puppies, and it stretches more. If they've had C-sections, remember there'll be scar tissue from where the C-sections were done, and the uterus was sewn together again. So breeding a queen or a bitch 3 times is usually enough. They are not puppy mills. They're not here for us to really make them a little farm or a factory out of them. So 3, maybe 4 times at the most, and then retire that bitch and get her spayed. Because unfortunately, the older they are, the more susceptible they are to pyometra, and that is where the whole uterus actually becomes filled with pus. So in addition to all your normal abdominal organs like the guts and the liver and the spleen, there's a massive abscess where in the abdomen, because the uterus is literally filled with milky pus.
It's horrible.
It is horrible. And the older the bitch is, the more her chances are of developing pyometra. So you don't want to wait for the dog to get to that stage, because that is a life-threatening condition. Mm. Sometimes the owners will be able to recognize this condition because, just like in humans, dogs and cats have cervixes. And if that is an open cervix, the pus is allowed to come out and the vaginal discharge is appreciated and noticed by an owner. If it is a closed cervix, the pus stays all in the uterus and the animal is off color, feverish, listless, inappetent, not wanting to interact or eat, and then should be seen by a vet. Pyometra often occurs within 4 to 8 weeks of the dog cycle or the cat cycle. So if it has been what we call an estrus, and 4 to 8 weeks later, it's off color, definitely get it checked out by a vet. So yes, spaying after 3 to 4 pregnancies is fine.
And let's say an owner says, okay, I've done one. No, it's time.
Never again.
What time frame after them giving birth would you say is an adequate time, once everything's sort of settled down, for them to come in and have a spay? So
the mum is with the pups until ideally 8 weeks old. I know some people do let the pups go at 6 weeks, but 8 weeks is a bit better in terms of behavioral growth and adaptation that the mum can teach the puppies. And at that age, when the pups are 8 weeks old, the uterus has what we call involuted, the mammary glands have now started to regress, and all those very, very big blood vessels that you do not want to interfere with when the puppies were still suckling or starting to get weaned have now shrunk down, and it's a much safer spay at that age. So you don't want to wait months until she's come into heat again. But you do want to wait until at least the pups are about 8 weeks old.
So once they've gone.
It's
a good time.
Yeah.
Thank you. That is very informative.
You are welcome.
Hopefully it's very helpful for our listeners. Certainly,
Yes.
great to discuss this. I know that it's a bit of a controversial subject where, nobody wants to talk about it because we don't want to encourage breeding.
No, we don't want to encourage breeding, but we do, when it does happen, we want it to be done safely.
Absolutely.
We want people to be aware of what can go wrong, because that's also important. It is a little bit of an ostrich with your head in the sand to just say, well, get it spayed, because that's not always the situation.
Absolutely.
It's what we would like to see. We would like to see more sterilizations because of the overpopulation. So all the owners, whether they're breeders or not, have that social responsibility and then the medical responsibility to prevent pyometra.
And if there's anything, hopefully this information will stress some of the problems that people can face and the financial implications, because often we get spaying and neutering is really expensive, but we know in reality...
not compared to a C-section.
Yeah.
Animals are not considerate of your wallet.
No.
And when they need a C-section, it is sometimes done in the middle of the night, where you're going to have to now pay after-hours fees, which can all be avoided, if that animal was maybe sterilized at the right age.
Absolutely.
But yes, those C-sections are an emergency procedure, often in the middle of the night, and are very costly because of the time and because of all the things that it needs to be a team of people on duty to anesthetize the animal, operate on the animal. There's a whole team of nurses and staff who are taking those puppies as soon as they're delivered and then reviving them and making sure they're fine. And like I say, tying off the umbilical cord, making sure they're breathing. It's a huge, huge procedure. It's a huge surgery.
Yeah. And even things like the milk fever. I mean, that is generally middle of the
multiple,
night.
Yes.
Have to go on IV fluids.
Stabilize seizures, blood collections to check calcium. There's a lot of things that can go wrong. It can be very costly. There's one very common misconception I've come across specifically in this area, or in the city, is that people think that the mother dog needs to have 1 litter and then be spayed, and that's more healthy for her. But it really isn't. It's a very common misconception, almost like an urban myth. But it does no good for the mother dog. In fact, there's been concrete research that if that dog is spayed at 6 months old, the chances of her developing mammary tumours as an older dog is over 98% less.
Jeez.
So... there's a lot of pros to spaying at the right time.
Absolutely.
A lot of pros.
Including, and I think, maybe owners don't have the awareness of this, but including, like you said, that even the blood vessel size. You go and you spay or castrate a dog at 6 months versus at maturity, in terms of anesthetics and surgical
100%.
risk.
100%.
There are many reasons, many factors to consider when tackling this.
Yes. I was thinking of saying something else.
Anything else you want to add, Dr. Derisha?
It's completely flown out of my mind.
Thank you so much once again for spending some time with me this morning.
It did come to me.
Do it.
If someone was planning on getting their cat or dog neutered or specifically spayed, but it escaped the yard and did get mated, you do not have to wait until the animal has puppies in the end and get it spayed. We do routinely spay an early pregnant mom. We can spay that mom. It is better to not have unwanted litters that you do not know, what you are in for. So you don't have to think that because it has been mated, that it definitely needs to have puppies.
That's going to open up another whole world of pro-choice.
It might, but this is more... someone was planning on getting the animal spayed, but unfortunately, when female dogs are on heat, they release pheromones for kilometers into the air, and male dogs come from all over the place to try and find that female on heat, and they can even mate through fences. So people will say to me, no, there's no way it could have been mated. And then they check CCTV cameras, and there's been a little bit of romance between the fences. Yes, male dogs that are intact are very determined.
Absolutely. And there are misalliance drugs out there as well. So, people are determined, no, they do definitely, this is a prize dog, and they're determined.
Yes.
There are ways of essentially terminating that pregnancy.
Because it wasn't the sire that they wanted.
So So lots of options out there. And I suppose
Lots.
the key take home here is communicate with your vet.
100%.
Communicate with another vet if you don't like their opinion, so that you can see that whether we're aligned or not. And reach out, and obviously, we're available if people want to discuss or make any comments.
Of course. Some very good 24-hour practices in this area.
Indeed.
Yeah.
Indeed. Thank you once again,
You're
Dr.
welcome.
Derisha.
You're welcome.
That brings us to the end of today's episode on pregnancy and gestation in our dogs and cats. I hope our conversation with Dr. Derisha Reddy has provided you with the knowledge that you need to support your pet through this important phase of their life. Pregnancy in pets can be both exciting and challenging, but with the right information and care, you can ensure the best possible outcome for both mom and her pups or her kittens. If you have found this episode helpful, don't forget to subscribe, leave a review, and share it with other pet owners. For more insights, follow us on social media and stay tuned for more expert advice on caring for your pets. Until next time, this is Dr. Kara, reminding you to keep your pets healthy, happy, and well-loved. But don't forget to give them a big hug from me. Welcome back to Just for Pets. You're with Dr. Kara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today and we'll deliver pronto.
Wow, I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.